Commissioner McCary, Deputy Commissioner Brenner, I'm tasked with taking my three colleagues who spoke before me and making it simple for everyone to understand. I'm going to speak specifically about the class label on local or low-dose vaginal estrogen products and freely admit that the FDA has a very complicated, oftentimes difficult balancing act in constructing a label that's understandable, that's straightforward, and that carefully and correctly balances risks and the benefits of a given product. I believe that in terms of the low-dose vaginal estrogen label, they have failed. Let's talk not all about all the characteristics and problems in constructing a good label. I'd like to talk only about two of them. The first is the label should be consistent not only with the product and the data presented on the product to the FDA, but also consistent with the scientific literature. You've heard some comments to this effect. In addition, the other characteristic I wish to talk about is that the label for a particular product needs to be consistent and fair with other products used for the same treatment. Let's not have the FDA giving a label that artificially gives more value to one product than another, or another product to the same product. That's for the business environment, not for the regulators. So I'd like to speak and expand to some comments that Dr. Pinkerton made as a good introduction. Here you see on the upper left an FDA-approved product, Invexi, 4 micrograms delivered vaginally, and at the bottom, Intrarosa, a different product, not an estrogen by characterization, and its label. Since the Women's Health Initiative in 2002 and subsequent class labeling changes, all estrogen products contain class warnings. In brief, and listed here, they include that vaginal estrogens can cause or be associated with stroke and dementia, namely the brain, heart attack, myocardial infarction, namely the heart, breast cancer, i.e. the breast, deep vein thrombosis, pulmonary embolism, and cancer of the endometrium. Now, in order for estrogen to get to those organs, we presume it has to go from the vagina into the blood and jump to the brain, the heart, the breast, etc. That's logical. Or to me, it's logical. But in fact, it doesn't do that. It just doesn't do that. And when you measure estrogen as a result of placing these low-dose vaginal estrogen products in the vagina, you cannot measure them in the blood. You cannot measure them in the blood. Maybe I'm not clear. You cannot measure them in the blood. So, you cannot interpret the delivery of low-dose vaginal estrogens as causing all these things that are horrible, painful, that keep patients from using the products when they need them based on their blood levels. So finally, the FDA requested that the makers of these products do large randomized trials, which they could not do, but large observational trials were done by the market leader in this case. I presented those data at the International Menopausal Society meeting last year on some 400,000 patients studied in the US and 200,000 patients studied in Denmark with no effect on the endometrium, and the endometrium is the first to be affected by vaginal placement. So let's look at consistency. The last consistency is these two products. The second one, Intrarosa, listed here on the bottom, and it has exactly the same blood levels as the Invexi product listed on the top, and the contraindications, and I'll list them: undiagnosed abnormal genital bleeding, any postmenopausal woman with undiagnosed persistent or recurrent genital bleeding should not use the product, and anyone with a past history of breast cancer should not use the product. But no heart attack, no stroke, no dementia, no deep vein thrombosis, the same blood levels. So the label needs to be changed for low-dose hormone therapy. It's not consistent with other products, and it's not in any way, shape, or form logical, consistent, or reasonable given the scientific literature.